hope that you are all doing well. Life is good, life is easy. And I wanted to take a couple of minutes and talk with you about the Assisi Loop. Now, I've been talking about this for quite some time because it really is an amazing device. If you are not familiar with it, it is a pulsed electromagnetic frequency device. And traditionally, we talk about it in terms of reducing pain and discomfort and things of that nature. And this is what this thing looks like. This is the 10-centimeter device. I have a cat and a dog that are traveling with us, and so that's really all that we need. There are tons of different options. If you've got larger pets, there's a larger one, but so there's a bunch of different stuff you can do. The reason I wanted to talk to you about this today is because the Assisi Loop can be used to treat many other conditions, and one of them is kidney disease. And so Pepe my cat is 13 years. He just turned 13 in January, and his creatinine has been kind of creeping up. So let me show you what that looks like. So if we look at his labs back in May of 21, we can see his SDMA, which is one of those things that probably measures kidney function or that kidney function is starting to go sideways before the numbers start to go up. We can see his creatinine is right at the top end of normal at 2.3. And then in January, we had the labs repeated. It's up to 3.1. In an older cat, it's not wonderful, but it's not horrible. So what did I do? There's a lot of different options out there. He thinks quercetin is a bad one. So I'm not able to get him to eat quercetin, unfortunately, which is the first thing I would recommend to any of my clients, because it does seem to help reduce inflammation at the kidney level. And also, it does help to prevent more destruction or fibrosis of the kidney tissue. So he wasn't buying that. We could add a little bit more water to his food, not very much, because if we made it too soupy, he's like, really, I'm a carnivore, I want to chew it. And then, so what did we do? We started using this. And so you can see this result is from January 6th of this year, 22. And so we're here in Guadalajara, hoping to get a cataract surgery for 𝘱𝘀. Unfortunately, that's not going to happen. But what we were able to do was get some blood work drawn for Pepe, and we're actually able to make 𝘱𝘀 more comfortable with her eyes. But what I want to show you is this. Here's what I want to show you. So again, here we are, May, with a creatinine of 2.3. January of this year with a creatinine of 3.1. And then here we are, February 16th of this year. And the creatinine is down to 2.43. So that's pretty awesome for a relatively easy to do intervention to start bringing these lab values down. Now, PEP's not the only one. I wanted to share this email from you, with you from Karen, and we're working on getting her a prescription for the Assisi Loop she purchased for her pup, and so that the insurance will pay for it. But the really cool thing is that Siggy is actually using the Assisi Lounge, which is sort of the larger format. It's got a couple of loops in there, and literally she would just lay down on it. Now, her BUN is still a bit high at 110, but look at this. Her creatinine dropped from 3.8 to 2.4, and her SDMA is now 14 and normal, and I think it was somewhere in the neighborhood of 24. So they're going to look into some other options, because obviously there's still some problems going on for Siggy, but that's a pretty amazing drop from, to have that drop 1.4 points she's eating the original CrockPET diet, of course, and keeping using some quercetin and things of that nature. But I mean, this was just awesome, and I had hoped for great results like this, but this is sort of beyond what I had expected. So just wanted to let you all know about this. Check it out. It's something we definitely carry in the shop, and so I will drop this link in for you. But it's just we can use it for a whole host of other things, and it's interesting, for cold laser therapy, which is something I had used in my practice. You could not use that anywhere near a tumor or anything of that nature. In humans, when they use pulsed electromagnetic frequency, they are able to use it to actually help women that have had mastectomies recover, which I think is pretty cool. So check this out. Check out a little bit about the language that's there, and also the research. They do have a ton of different options, for pets that have had serious dental issues and maybe they're not able to undergo anesthesia. You would simply put the loop over the mouth and treat that painful sore mouth with the loop to help get rid of infection and reduce pain.